If your menstrual cycle is 26 days, your ovulation happens on day 12, and your unsafe days, meaning the time you are most likely to get pregnant, ranges from day 7 to day 13. But if your menstrual cycle is 32 days, your ovulation depends on day 18, and your fertile window or unsafe days, meaning the time you are most likely to get pregnant, ranges from day 13 to day 19. Welcome again to our Holistic Health Talk. This video is about natural family planning. Ladies and gentlemen, in here we'll discuss the following questions. Number 1, what is family planning? Number 2, what are natural family planning method, goals, and their underlying basis? Does natural family planning really works? What are the benefits of natural family planning? Number 5, who can use natural family planning? Number 6, how effective are natural family planning method? Is natural family planning based on guesswork? Number 8, what are challenges surrounding natural family planning and how to overcome them? Ladies and gentlemen, there is a lot to learn today, and we highly recommend you to watch this video to the end. And before we start, if not subscribed yet, please subscribe to our channel now and activate notification bells. Also remember to like and share videos with friends and colleagues. Thank you. Question number 1, what is natural family planning? Natural family planning, also referred to as NFP, is the general title for natural and scientific method of family planning that can help couples either achieve the pregnancy, either avoid the pregnancy, or better, postpone the pregnancy at a certain period of couple's life. Though all natural family planning methods do not rely on fertility awareness techniques, most guidelines use the fertility awareness-based method, or FAMS, as synonyms for natural family planning. The word natural here basically means there is no need of using pills, surgeries, or device to achieve family planning. So, what are the goals of natural family planning? The success of natural family planning is enhanced by use of multiple techniques to identify the fertile time, also refers to as the unsafe days. So the natural family planning has 2 goals. Number 1, recognizing the signs of fertility days, meaning the time you are most likely to get pregnant, also called unsafe days. Number 2, avoiding these fertility days or unsafe days in order to avoid a pregnancy or better, to postpone a pregnancy. So, what are the methods of natural family planning? To achieve natural family planning goals, the woman must be able to recognize her fertile time or unsafe days. Recognizing the fertile time of the menstrual cycle is managed through several methods, either alone or in combination. These methods are classically divided into 2, on which we'll add 2 more. Number 1, the calendar-based method. Number 2, the symptoms-based method. Apart from the 2 classical categories of natural family planning, we'll describe 2 more categories. Which are the symptom-hormonal testing method and the Lactational amenorrhea method. How does natural family planning works? Number one, the calendar-based method. Two types of calendar-based method can be described. Number one, the standard days method or SDM. And number two, the personalized fertility days method. We start by the personalized fertility days method because it's more accurate and it tries to define the specific fertility days for each woman with a well-defined regular cycle. Recognizing fertility days, also called unsafe days, because that is the time you are most likely to get pregnant, and safe days, meaning the time you are not likely to conceive, rely on understanding of the following. Number one, the personal menstrual cycle duration. Number two, the specific and estimated ovulation for each personal menstrual cycle. Number three, the lifespan of the male reproductive cell. Number four, the lifetime duration of the female reproductive cell or ovum. Understanding these have helped many define almost clearly and accurately the fertility days, also called unsafe days, and avoiding them when necessary. So, the personal menstrual cycle. Your menstrual cycle lasts from the first day of your period until the day before your next period starts. This is about 28 days on average. But shorter and longer menstrual cycles, from 21 days to 40 days, are considered to be normal. During your cycle, an egg is released from one of your ovaries. This is called ovulation. And then the female egg or ovum is captured by the fallopian tube, in which it then travels down the fallopian tube waiting to be fertilized by the male reproductive cell. There are always 14 days between ovulation and the next period, irrespective of the duration of the cycle as a whole. So, at the family planning point of view, the menstrual cycle is usually divided into two periods. The period before ovulation or pre-ovulatory period, and the period after ovulation of the post-ovulatory period. The period before ovulation is variable, which means that it changes in duration from one woman to another according to the duration of each person's or each woman's menstrual cycle. But the period after ovulation is usually considered of the same duration for every single woman. And this period after ovulation or post-ovulatory period is considered to last 14 days for every single woman, regardless of individual menstrual cycle duration. This is just general for the practice of natural family planning because small variations in the post-ovulatory period have also been observed in some women. So if we consider the post-ovulation period to always last 14 days for every single woman, while the normal full menstrual cycle duration varies from a woman to another from 21 days to 40 days, the pre-ovulatory time or the time before the ovulation will significantly change with the personal menstrual cycle for each woman. This means if your menstrual cycle is 21 days, your ovulation will happen on 21 days minus 14 days. And if your menstrual cycle is 40 days, your ovulation will occur on day 40 minus 14 days, which is on day 26. So when does your personal ovulation occur? If your cycle is 21 days, your ovulation will occur on day 7, counting from the first day of your period. If your cycle is 22 days, your ovulation usually occur on day 8, from the day 1 of your period. If your menstrual cycle is 23 days, your ovulation time happens on day 9 from day 1 of your menstrual period. The following is the full list of estimated ovulation time for each normal, individual, and specific cycle. So, if your menstrual cycle is 21 days, your specific and estimated ovulation day is day 7, counting from the first day of your period of menses. If your cycle is 22 days, the estimated ovulation day is day 8 from the first day of your menses. For the 23 days cycle, the estimated ovulation day is day 9 from the first day of your period. For 24 day cycle, the ovulation will be on day 10 from the first day of your period. For a 25 day cycle, the ovulation will most likely happen on day 11 from the first day of your menses. For a 26 day cycle, the ovulation day is day 12 from the first day of your period. For 27 day cycle, ovulation day is day 13. And from a 28 day cycle, ovulation day is day 14. Remember the famous day 14 we all talk about. But as we've seen, ovulation does not happen on day 14 for all women. 29 day cycle, ovulation day is day 15. For 30 day cycle, ovulation day is day 16. For 31 day cycle, ovulation day is day 17. 32 day cycle, ovulation day is day 18. 33 day cycle, ovulation day, day 19. For a 34 day cycles, ovulation day is day 20. A 35 day cycle, ovulation day, day 21. 36 day cycle, ovulation day is day 22. 37 day cycle, ovulation happens on day 23. For 38 day cycle, the ovulation happens day 24 of the menstrual cycle. And 39 day cycle, ovulation usually happens on day 25. And for a 40 day cycle, the ovulation day is on day 26 of your menstrual cycle, counting from the first day of your menstrual period. Remember, we consider the post-ovulatory period to be constant for every single woman, and it is 14 days before the next period occurs. That said, your journey to a successful family planning starts with recognizing your specific menstrual cycle in terms of length, and then establish your estimated ovulation day, knowing that the post-ovulation period is always 14 days irrespective of your specific cycle duration. But remember, your menstrual cycle starts from the first day you see your period and end one day before you see the next period. This means if your last period started on the 2nd November, the 2nd November the first day of a cycle. And for example, if you see your next period on 30th November, this means that your cycle started on the 2nd November and ended on 30th, minus 1 day, which is 29th November. And most importantly, it means that your cycle is 28 days. The third biological theory that will help you achieve your family planning goals is the reproductive cell's lifespan. After ejaculation, the lifespan of the male reproductive cells or male sperms depend on many circumstances. Ejaculated sperm remains alive or viable in the female reproductive tract for several days, with an average of 5 days. But in laboratory, sperm can be preserved for decades if semen is preserved, but that is a topic for another day. Number 2, however, after ovulation, the female egg or ovum only lives 12 to 24 hours. So for a woman to become pregnant, the female egg must be fertilized at that specific time. So how long does your fertile window, the so-called unsafe days, last? And how to define yours specifically? Based on the previous theory, the fertile window fertility days, also called unsafe days, is considered to be about 7 days regardless of your menstrual cycle duration. It begins 5 days before ovulation, plus the ovulation day that we have already defined, and plus 1 day after ovulation. And do not forget, this applies for all women. So if you know the length of your cycle, it is possible to clearly define your ovulation based on the fact that the post-ovulation period is always 14 days, regardless of your cycle duration, and then define your fertility days or your fertile windows, also called by some unsafe days, which goes from 5 days before ovulation, plus the day ovulation, plus 1 day after ovulation. So let us repeat our exercise and let's make it very clear once as much. If your cycle is 26 days, your estimated ovulation day is 26 days minus 14 days, which is day 12. Then the fertile window, also called unsafe days, will go from day 12 minus 5, which is from day 7, plus the day 12 or the day of your ovulation, plus 1 day, which is day 13, which is 1 day after ovulation. So your fertility window will extend from day 7 to day 13. This is the time where you are most likely to get pregnant or to conceive. This is the time your couple should skip to avoid pregnancy, or better, to postpone pregnancy. Our team have calculated the fertile window or unsafe days for all menstrual cycle lengths that you can use to achieve your natural family planning goals. As you check this table to find your specific menstrual cycle duration, your ovulation days, and your defined unsafe days, or the time you are most likely to get pregnant, to conceive, please subscribe to your channel now so that you don't miss any useful contents. Thank you. The second calendar method we are going to describe is what we call the standard days method, or SDM. This calendar-based method is simpler and much easier to apply but less accurate than the personalized fertility days method that we have already described previously. But like the personalized fertility days method, the standard days method is based on the fact that there is a fertile window during the woman's menstrual cycle when she can become pregnant. And typically this window occurs several days before ovulation and a few hours or few days after. But the specific rule of standard days method is that the fertile window during which all couples must abstain to prevent pregnancy is standard, which means the same for most women, and ranges from day 8 to day 19 for all menstrual cycles, ranging between 26 days and 32 days, which are however known to be the most common menstrual cycles reported in women. So, the standard days method, or SDM, is suitable for all women with regular menstrual cycles ranging between 26 days to 32 days, and for all women with non-slight irregularities in menstrual cycles that changes from 26 days to 32 days. In other words, if you have a regular cycle among the following: 26 days, 27 days, 28 days, 29 days, 30 days, 31 days, or 32 days, or if you have a non-irregular cycles, which means your cycles are not the same, and those irregularities are well established and changes from 26 days to 32 days, you can also use the standard days method. The standard days method, or SDM, is 88 to 95% effective with correct use among women with regular cycles of 26 days to 32 days. The standard days method is becoming more popular in many countries where providers have implemented the use of cycle beads. The cycle beads is a color-coded string of beads used with standard days method that represent days of a woman's menstrual cycle. Cycle beads help the woman track her cycle days, know on which days she's fertile, and monitor her cycle length. The couple must abstain on the 12 fertile days identified by the beads. Cycle beads help as visual tool to help women use the standard days method correctly. Cycle beads may also help women establish clearly the length of their menstrual cycle. The full video on the use of cycle beads will be a video topic on this channel soon. But for women with significant irregularities in menstrual cycles, the calendar-based method might not be suitable for them, and they must consult their family planning doctor for more personalized family planning plan. Though the calendar-based method as described previously can be effective alone, other methods of natural family planning are usually needed to optimize their efficacy. Number 2, the symptoms-based method. Symptoms-based method depends on observation of signs of fertility. So what are signs and symptoms of the fertile period and ovulation? Physiologically speaking, the unsafe days of fertile window is not a silent moment. There are many signs and symptoms that usually comes with that moment, and it is possible to recognize them. Recognizing these signs and symptoms will support your journey toward a successful natural family planning. Of course, you have to clearly define your personal menstrual cycle duration first, its related ovulation day, based on the 14 days post-ovulatory period rule, and your specific fertile window or unsafe days that our team took pleasure to calculate for you. While in your fertile years, your body provides several basic ways to identify the fertile and infertile days of your menstrual cycle. The rise and fall of reproductive hormones, mainly estrogens and progesterone, are responsible for these signs and symptoms. Recognizing the pattern of those physical signs form the symptomatic approach basis for all methods of natural family planning. The following are physical signs surrounding ovulation time and therefore the fertility days, also called unsafe days. Number 1, cervical changes. Cervical changes assessments constitute by themselves a family planning method, also called the Billings family planning method, or the cervical mucus method, also called Billings ovulation method. Around the time of ovulation, mainly few days before the release of the female egg by the ovary, a fluid or a mucus is released from the woman's cervix, the opening of the uterus. When cervical mucus is present, it has the ability to keep sperm alive in the woman's body for several days with an average of 5 days. In the cervical mucus method, also called Billings ovulation method, the days of infertility or safe days, The possible and maximum fertility days of the menstrual cycle are defined by observation of changes in the cervical mucus. The woman identifies the fertile time by observing the characteristic of the cervical mucus. And to use this method correctly, you should, number 1, abstain on the time of menstrual periods. Number 2, abstain in case you notice any secretion. In fact, the fertile phase of menstrual cycle begins with the appearance of a mucus secretion, which changes as the day go by, becoming more stretchy and slippery. Number 3, you should recognize the evidence of ovulation, also called the peak day, when the mucus is very clear and stretchy. This is called the Spin-Beckett signs. Number 4, you should continue to abstain for 3 more days after the peak day, even if secretions completely disappeared before 3 days have expired. Number 5, safe days, meaning the days you are not likely to get pregnant, start 4 days after the peak day. The second sign of fertility days or unsafe days is the rise in the basal body temperature or BBT. The rise in the basal body temperature is another sign of fertility that can be observed in women's daily waking temperature, basal body temperature. The body basal temperature is taken after several hours of uninterrupted sleep. Your basal body temperature is lower prior to ovulation and will rise 0.4 to 0.7 degrees Fahrenheit, which is about 0.2 degrees to 0.5 degrees Celsius, and stay elevated after ovulation. The highest elevated temperature is considered as the signal of the end of the fertile window. With the basal body temperature method, you are instructed to take your temperature orally at a time each morning before getting out of bed and before eating anything. The routine of taking the temperature must be the same for the entire cycle. Temperature reading are recorded on a special graph paper, which makes it easy to identify small changes in the temperature readings. Number 3, changes in shape and texture of the cervix. Changes in shape or texture of the cervix itself is an additional sign of a woman's fertility. During the infertile time of the menstrual cycle, the cervix is low, closed, and firm. Around the time of ovulation, the cervix is high, soft, and open. Number 4, other signs or secondary signs of ovulation. Ultimately, at the time of ovulation, you can observe other optional signs such as mild pain in the breast or a sharp abdominal pain, also called the Mittelschmerz signs. Number 5, the Symptom-based method. This mixed symptoms-based method observes several signs of fertility and cross-coach 2 or more of the signs to pinpoint the day of ovulation. The Symptom-based method typically combines charting on the basal body temperature and the cervical mucus with other optional indicators such as changes in the cervix and secondary fertility signs. The signs and symptoms using the Symptom-based method include the rise in the basal body temperature, the cervical changes in terms of consistency, position, and dilatation, and the cervical mucus or Billings method. The fourth method we are going to talk about is the hormonal testing method, which consists of testing hormones in the urine. This method is also sometimes called the symptom-hormonal testing method because it combines physical signs of fertility and add the use of an ovulation predictor kit or fertility monitor. Similar to the symptom method, this approach adds the self-detection of reproductive hormones in the urine with the assistance of an ovulation predictor kit or fertility monitor. This method relies on the fact that the rise of certain reproductive hormones is observed at the time of ovulation. With the development of ovulation predictor kit, the rise of reproductive hormones such as estrogen and LH can be observed during fertility days, also called unsafe days, and measured qualitatively, even quantitatively. One of the examples to the hormones testing method is the market natural family planning model. The market model brings technology to natural family planning by using fertility biomarker device in the urine collected at home. In the market model, the clear blue easy fertility monitor, including several different biomarker detectors, measures urinary biomarkers such as estrogen, LH, and progesterone. These biomarkers are usually used in combination with cervical mucus or basal body temperature and an algorithm to confidently determine the woman's fertile window. The market model of natural family planning is suitable for all couples seeking to space pregnancies, all women around menopause, and for all women with irregular cycles. And for the breastfeeding and lactating mothers wishing to optimize their natural family planning success. Observing signs and symptoms of ovulation and fertility have given rise to what is called the diversified approach of natural family planning, which combines different methods to clearly define your menstrual cycle duration, your ovulation day, and your fertile window as previously calculated. The diversified approach combines both the calendar-based method, personalized fertility days, or standard days method where applicable. Each diversified or combined natural family planning method is focused on one or more signs of female fertility used in conjunction with one of the calendar-based method. One example of the combined approach of natural family planning is the symptom method with the standard days method. Another method of natural family planning we are going to describe is the lactational amenorrhea method, which is considered as a subset of natural family planning, which is a temporary postpartum method of family planning based on the natural effect of breastfeeding on fertility. Lactational amenorrhea works basically by preventing ovulation, but for this to occur, exclusive breastfeeding is mandatory. Therefore, the success or effectiveness of breastfeeding to prevent ovulation depends on the user, who is the breastfeeding mother. Effectiveness of lactational amenorrhea. Lactational amenorrhea method is 98% effective in the first 6 months of exclusive breastfeeding, which means that only 2 out of 100 mothers using exclusive breastfeeding family planning method will conceive using this natural family planning technique. Lactational amenorrhea method to be really effective, the 3 following criteria must be met. The mother's menstrual period have not resumed since delivery. The baby is exclusively breastfed at least 30 minutes every 2 hours during the day and at least 30 minutes every 4 hours at night, and in between breastfeeding on demand. Number 3, the baby must be less than 6 months before you can see the breastfeeding as family planning method. So if one and any of these 3 criteria is no longer met, Another method of natural family planning among the previously mentioned must be introduced in a timely manner to ensure healthy birth spacing. So, how does lactational amenorrhea works? The hormone prolactin, which is released during continuous breastfeeding, suppresses ovulation, which makes pregnancy unlikely. For more information, please watch our video on breastfeeding on this channel. Also subscribe to watch more videos on similar topics. Thank you. What are advantages and benefits of lactational amenorrhea method? Lactational amenorrhea method, or exclusive breastfeeding family planning method, has two types of benefit. We have contraceptive benefit and uncontraceptive benefit. Contraceptive benefit include effective family planning as long as the three lactational amenorrhea criteria are met. Number 2, immediate return to fertility once you stop exclusive breastfeeding. Non-contraceptive benefit of lactational amenorrhea method are: Number 1, breastfeeding passively boosts child immune system against common childhood illness. Number 2, counseling for lactational amenorrhea method encourages couples to initiate another natural family planning method as soon as indicated. Number 3, lactational amenorrhea method is free and does not interfere with the couple's lifestyle. Lactational amenorrhea has no known health risk. The following question we are going to discuss is: does natural family planning really work? If natural family planning is used properly and consistently, it can be up to 99% effective. But you have to keep a daily record of your fertility signals, as mentioned previously. And studies show that it takes 3 to 6 cycles before you learn the method. Moreover, in some cases, the fertility signals can be affected by illness, stress, and travel-related health problems such as jet lag and travel fatigue. Watch our video about the jet lag on this channel. Number 4. What are advantages of natural family planning? Unlike other family planning method, natural family planning uses no drugs, no devices inserted in the body, nor surgical procedures. And for this reason, natural family planning method are considered safe and moral in all cultures, religions, and in all health institutions. No drug, no device in your body, no surgical procedure also means no harmful side effect, no health risk. Other advantages of natural family planning method are inexpensive, they are friendly for the environment, they are useful to either achieve or avoid pregnancy, they can be used throughout the reproductive life cycle, they can foster mutual communication between the couple, they encourage respect for and acceptance of the total person, they value the couple's offspring, and moreover, they promote moral and religious values. Are natural family planning method based on guesswork? No. Natural family planning methods are based on the scientific observation of the naturally occurring signs and symptoms of the fertile and infertile phases of a woman's menstrual cycle. This is not a guesswork, but they are based on scientific observation and evidence. What are challenges surrounding the natural family planning method and how to overcome them? The first challenge is that the length of your cycle can vary over time So try to make sure your calculations are as precise as possible. Keep on measuring your cycle over and over. Studies show that it takes 3 to 6 cycles to clearly define one cycle's duration and the specific ovulation day, and therefore the fertility window. Other symptoms of ovulation also help to recognize the ovulation day and to clearly define the fertile window or unsafe days. The second challenge is that your fertility signal can be affected by illness, travel, and stress, but you can overcome this by keeping daily record of them out of non-illness, combined with having regular checkups with your doctors. The last and more common challenge of all natural family planning method is the law of least effort, specific to the human nature. In the world that offers many ways of family planning, couples usually have tendency to consider what they think to be the easiest regardless of side effect, and with no consideration to religious and moral ethics. But remember all the benefit that offer natural family planning. In view of all the benefit offered by natural family planning method and the high success rate when methods are well applied, there is no reason not to try natural family planning in order to prevent or better to postpone pregnancies. Challenges surrounding natural family planning are usually overcome when couples establish continuous health communication with their healthcare providers. I'm Dr. Eric. This channel delivers information that promotes health and holistic wellness, as well as lifestyle safety tips.
Wow!
All the content is tailored for educational and informational purposes. And we hope this video on natural family planning was very helpful, and we thank you all for your continued support to our channel. And if not subscribed yet, subscribe to our channel now and activate notification clock. Kindly remember to like and share our content with friends and colleagues. Thank you for watching. See you in our next video soon.